Assalamualaikum everyone, this is Dr. Abdul Raffay here again and welcome back to the part 2 of acute coronary syndrome from the section cardiology. So without wasting any second, let's get right into the video. Previously we talked about stable angina and unstable angina and due to which non-modifiable and modifiable risk factors plaque formation occurs in the arteries and they cause ischemia and infarction. Now, a plaque formation happens and volume of the vessel decreases, then plaque rupture and thrombosis occurs, the volume decreases furthermore and causes ischemia and infarction. But now we'll continue that what if complete occlusion of a vessel occurs. If there is a complete occlusion, there will be no supply of blood, there will be no supply of oxygen, so there will be infarction, as I said before, distally from the vessel, which will gradually progresses to the proximal site, and your cardiomyocyte will become necrotic, and that's when the patient gets myocardial infarction. That's where your heart muscle starts to die, that's where your muscle starts to get necrosed. So these are your coronary arteries, and if they occlude, then there will be an area of infarction which causes the death of cardiomyocyte. So this unstable angina and MI, they both contributes in the acute coronary syndrome. And in stable angina, if patient rests, the symptoms goes away and it will be classified as stable angina. Now moving on to the clinical presentation, obviously there will be some clinical signs and symptoms of a person having an angina or having a non-STEMI or STEMI, that is non-ST elevation myocardial infarction and ST elevation myocardial infarction. Number one, there will be a diaphoresis, that is the increase in sweating. There will be a central chest pain that will radiate to neck, jaw and arm. Central chest pain that will radiate to neck, jaw and arm. And this chest pain will be like crushing and heaviness, tightness. Other than that, nausea, vomiting will be there, and there will be a feeling of impending doom. Now if a person rest and pain goes away, that will be classified as a stable angina, as I have said before. Now there are some differential diagnosis related to the chest pains or related to the angina or related to the MI, and these are pericarditis, that is the inflammation of pericardium. Number 2, endocarditis, that is the inflammation of endocardium. Aortic aneurysm, there can be a pericardial effusion which can mimic anginal pain. Anxiety is the most common differential diagnosis of chest pain. Other than that, there can be a pulmonary embolism, and lastly, esophageal rupture. Now when the patient gets MI, or whether it's NSTEMI or STEMI, and the cardiomyocyte undergoes necrosis, and when a cardiomyocyte undergoes necrosis, there will be a release in two types of enzymes in plasma levels. Number 1, troponin, and number 2, creatinine kinase, CKMB, known as CKMB. Okay, so there will be a rise in both of these enzymes in plasma levels. Number 1, creatinine kinase is the first cardiac enzyme to rise and fall, and secondly, troponin is the most sensitive cardiac enzyme which will be released in the plasma after an MI. So now The troponin levels increases from day 1 to day 3, and then they starts to regress. But troponin levels remains high for longer levels in comparison to creatine kinase, and it starts to rise from 4 to 6 hours and goes back to normals after 2 weeks. Secondly, the creatine kinase, it is the first enzyme to rise and fall. It starts to rise 4 to 6 hours, and its peak occurs at 12 hours, and it goes back to normal in 48 to 72 hours. Now, if you perform lab work, then you find troponin or CKMB in the plasma levels, that will confirm that patient had gone STEMI or non-STEMI. So these two enzymes are very important to remember, and they do play important role in the lab works. So this was all for today's lecture. This is the part 2, and I hope I will meet you guys in the part 3 very soon. Thank you so much. If you find the video helpful, do like, share and subscribe to my channel, as this will motivate me to do more of such kind of videos. Thank you, and Allah Hafiz.